Thank you all for your really enlightening testimony. I wanted to first start out by saying representatives from three organizations, namely the Robert Crown Center for Health Education, the DuPage County Board, and the Gateway Foundation have provided additional testimony for the record about local efforts to combat the opioid epidemic in Illinois. Mr. Chairman, I request unanimous consent that this testimony be made part of the official record for today's hearing.
Without objection.
Thank you.
Order.
I'd like to start, I have several questions, so I ask everyone to please be brief. But first, I'd like to start with Ms. Ayala. Thank you again. We're honored to have you here today. Ms. Ayala, how has the federal grant landscape shaped the work you're able to do with the HOPE Task Force?
So it was not part of my comments provided earlier, but we have been a recipient of the Drug-Free Communities Grant for the past 5 years. That, as the other members providing testimony, has provided us with an opportunity to coalesce a group and really provide the framework in which we can develop a more expanded approach based in the local community to meet our needs. Primarily, the efforts and the funding that we have received from the federal level so far have been around the use of naloxone, which we greatly appreciate, and it is very much needed within our community. However, one of the opportunities I think that grants such as the Drug-Free Communities and the HIDA model provide is an opportunity for local communities to better define where their needs lie versus the categorical funding that has been historically provided to us.
Got it. Thank you, Ms. Ayala. Ms. Haskins and Ms. Roberts, with the drug-free communities grants that you've received, could you each just talk about a couple tangible examples of how you use that money to reduce the addiction rates in each of your counties? I was especially interested in Ms. Haskins' testimony about the reductions pretty much across the board. Could you talk about this, the tangible application of the money?
Absolutely. The very first year that we began our coalition, back in 2009, we had 16 youth die in a matter of 2 years, all pretty much from the same graduating class. So that's pretty difficult for a community to put aside and not recognize that we have a prescription drug issue. We were able to do a comprehensive public awareness campaign to help bring that forward and help kick off some conversation that otherwise was not being had in our community. We educated anybody from preschool all the way up to the elderly who participate in our senior centers. We had pharmacy students that would come in and volunteer their time to go over medications with the elderly and let them know what were some of the medications that were being taken out of the home, or watching mailboxes to take that medication out of mailboxes that had been sent through the Postal Service. So our comprehensive public education strategy was probably the biggest thing that we've done. We have also helped, that money has also helped us utilize, like I said, the destruction of prescription pills. We have 3 static take-back locations that we advertise constantly. We usually get, we're a county of 29,000, and we usually get about 99 pounds of medication back per quarter. It is fiscally difficult to destroy that medication properly. So one of the things that we were able to utilize, only $2,000 of our federal money was to build and purchase an incinerator for our community so that we can destroy these pills and it won't be a financial burden on our community. We then took that idea and we advocated that that needs to take place throughout the state of West Virginia. So therefore, we now have regional incinerators throughout the state of West Virginia to help other small communities like our own. When you do public education and you are going into the classroom and you're teaching kids, you're teaching parents what to watch for substance abuse, you're teaching teachers what substance abuse looks like so that they can understand, when kids are high in the classroom. We've done law enforcement training. to train them on diversion, because when we started seeing pill issues in our county, law enforcement didn't have a clue. They don't know if it's a blood pressure medication or if it's an oxycodone. You know, so those types of trainings were very important, and our DFC funding enabled us to do all of those skill building opportunities. And that's how we ended up with a reduction across the board, was all of our educational opportunities that we're able to provide.
Thank you.